Hey everyone, welcome back to the channel. Today we're talking about something that a lot of people experience but don't always talk about: peeing during sex. Is it a normal thing, or could it be a sign of a bigger issue, like an infection? Let's dive into it and clear things up. First off, let's just say you're not alone. Peeing during sex is more common than you might think, especially among women. It might happen for a variety of reasons, and it's important to understand what's going on in your body. So, in this video, we'll explore why this might happen and what you can do about it. Let's talk about the most common causes. There's a range of factors that could lead to that uncomfortable urge to pee during sexual activity. Some of them are completely normal, and others could point to underlying issues. First, let's discuss weak pelvic floor muscles. These muscles support your bladder, uterus, and other pelvic organs. If they're weak, due to things like pregnancy, childbirth, aging, or lack of exercise, it can be harder to control your bladder, especially during sex. Strengthening these muscles with pelvic floor exercises, like Kegels, can help improve bladder control. So if you're experiencing this, start doing those exercises regularly. Another reason could be an overactive bladder. This happens when your bladder muscle becomes too active and you get sudden urges to urinate. During sex, physical stimulation might trigger these urges, causing leakage. It's pretty common during orgasm, too. Next up, we have urinary tract infections, or UTIs. Unfortunately, this is something that affects millions of people around the world. UTIs can irritate the bladder and cause frequent urges to pee. The pressure from sex could trigger those urges and result in leakage. If you think a UTI might be the cause, make sure to get checked out by a doctor and follow their treatment plan. Stay hydrated, practice good hygiene, and talk to your doctor about any recurring symptoms. Certain anatomical issues might also play a role. For example, pelvic organ prolapse is when the bladder or uterus descends and presses on the urethra, which can make it harder to control your bladder during sex. This is common after childbirth. Then there's urinary incontinence, when your bladder just can't hold urine properly. This could be due to nerve damage, muscle weakness, or aging. Research shows that about 25% of women with urinary incontinence experience leakage during sex, and sometimes it's just sexual arousal. The heightened blood flow and increased sensitivity in the pelvic area can trigger a reflex that makes it feel like you need to urinate. This isn't a sign of infection, but rather just a response to the stimulation. Now, you might be wondering, how can you tell if it's actually urine or if it's something like female ejaculation? Here's the difference. Urine comes from the bladder and exits the body through the urethra. Female ejaculation, on the other hand, comes from the Skene's glands near the urethra, but it's distinct from urine. While urine is usually pale yellow, female ejaculation is often clear or slightly cloudy. Also, the amount of fluid is usually different. Urine tends to be released in a steady stream, while female ejaculation can be a gush or a smaller release. So what can you do if you don't want this to happen? Here are some tips to help prevent it. First, as I mentioned earlier, doing pelvic floor exercises like Kegels is key. Strengthening those muscles can give you more control over your bladder. Next up, bladder training. This technique involves gradually increasing the time between bathroom trips. By slowly training your bladder to hold more, you might find you can go longer without the urge to pee, even during sex. If you're dealing with pelvic organ prolapse, a pessary might help. This is a medical device that supports the pelvic organs, keeping them in place and reducing pressure on your bladder. For those with overactive bladder or urge incontinence, medications can help relax the bladder muscles and reduce frequent urges to pee. But be sure to talk to your doctor before starting any new medications. If you're dealing with constipation, it could be putting extra pressure on your bladder. So eating a fiber-rich diet and staying hydrated might help prevent leakage during sex. In more severe cases, surgery might be necessary, especially if you're dealing with pelvic floor damage or a prolapsed bladder. There are options like bladder sling surgery that can offer more permanent solutions. Lastly, if a UTI is the cause, antibiotics can treat the infection and help relieve symptoms. Make sure to drink plenty of water and maintain good hygiene to prevent future infections. So there you have it. Peeing during sex isn't always a cause for concern. but it can be a sign of something that needs attention. Whether it's a simple reflex or a condition like urinary incontinence or a UTI, there are ways to manage it. If it's bothering you, make sure to speak to your healthcare provider to get the right treatment. Don't forget to like, subscribe, and hit the notification bell for more videos like this. And as always, drop your questions or thoughts in the comments below. We love hearing from you. Thanks for watching and take care of yourself.